Hi, this is my third pregnancy vlog. In my last video I was talking about having some early pregnancy bleeding. I was still having that over the weekend and on Monday when I went to my placement. And I had a scan, an early scan booked for Wednesday, which is tomorrow. But I decided that I just couldn't wait any longer to find out what this bleeding was about. I was getting really worried and stressed about it, so I decided that I was just going to go to A&E because I was getting pain by this point as well. So after work I went down to A&E, told them what was going on. They immediately saw me very quickly. This was Bank Holiday Monday. Saw me, really quick. I thought I was going to be in there for hours, and I was in and out quite quickly. Went into a bed. The doctor felt my stomach, had a chat with me. They stuck a cannula in my arm, which really hurt. Because I don't know, it always really hurts when I have them put in. I have bad veins. Had to put a hospital gown on, so I was freaking out by this point. Then she said to do to pee into a cup, which I did. And then she came back, and they took some blood as well from the cannula. And she came back. She said the urine test was negative for any infection and positive for pregnancy. So then they took me to the gynecological ward, and they said they were going to do a scan, which I was quite surprised about because I thought they were just going to do my HCG results. And my partner wasn't even there, so I rang him and said, "Look, can you get here within the hour?" But he didn't get there in time because they decided basically immediately that they were going to do the scan. So I got into the room, ultrasound the lady, and she was going to use a transvaginal scan. And if you haven't seen one of those before, it's just like a longish probe that they put like a sheath over and lubricate it and put it inside you so that they can look. It doesn't go into your cervix or anything, it just goes inside your vagina, and so it can give you a better picture, especially when it's early pregnancy and the baby's quite far deep down into the uterus. She asked me if I had an empty bladder as well, which apparently is important to empty your bladder completely. So she did that, and it's quite good because they have their monitor there, and then they also have one like above you as well, so you can see what's going on. And immediately I saw the gestational sac, which was kind of longish. Well, I'll show you in a minute on the picture. Yeah, and she pointed out where things were, and should you see that little like flickering? That is the baby, and that's its little heartbeat. She didn't tell me what the heart rate was or anything, but I could definitely see it there. It was all growing in the right place. It wasn't ectopic, so there was a student present there as well, which I didn't mind because obviously I'm a student nurse myself. So yeah, it was amazing to see that. It's just a real shame my partner wasn't there. Everything looked fine. Like it was a viable uterine. Well, in the uterus anyway. Pregnancy, and yeah, she thought everything looked fine, and I'll now show you the picture. Now this is not clear at all. It was much clearer on the when she actually did the scan, and you can hardly see anything, but you can see the gestational sac, and if you can make out a very small white kind of blob in the middle, that is the yolk sac, and then just coming off that is the fetal pole, and then it's the baby, which is absolutely tiny. Something like crazy from crown to rump is like 9 millimeters or something, so really small. So yeah. So yeah, she said it was a viable intrauterine pregnancy. So very pleased about that. I asked her if what the HCG levels were, should they weren't back yet. It was irrelevant anyway because you saw the heartbeat on the scan, and I left the hospital and rang later on, and they can't give you the HCG levels on the phone. I just really wanted to know for my own curiosity, really, because last time when I had the ectopic, they never really went above I think it was like 70 or 80. So I'm going to get those tomorrow, hopefully. But it was just really amazing to think that it's only really been 42 days since my last period, and already there's a little heart beating in there. It's really amazing. It's very special, and it's just really exciting. But yeah, I feel fine. I had uni today. Still got really quite sore boobs. Still get very hungry. And really can't tolerate cigarette smoke at all. Makes you feel quite sick. And alcohol, can't tolerate that at all. Don't want to have any at all. Just doesn't make me feel well thinking about it. Just totally gone. I think that's your body's way of I don't know, trying to stop you from having it, really. So I'm just feeling quite headachy now and tired, and just looking forward to going to bed, really, which is what I've been feeling like most nights. I'm hoping that will improve in the next few weeks, but no, still no sickness or anything like that, which is great. So we'll just wait and see, really. So yeah, I'll keep you posted, but that's all for now. Thank you for watching. Bye.